Well, hello everybody. I hope you've been wearing your mask. I know that I have. I feel like a clinician. I've been walking around with this on, telling everybody to get me stuff stat. I hope that works better for you than it has for me up here around our office. But I want to do something a little bit different today. I'm no video editor, but I have put together some stuff on my computer, some recent data that I want to share with you, and then also some photos and videos that have come to me by way of Facebook and other things. So I'll narrate from here on out, but I hope you enjoy Wednesday's video. Thank you.
Okay, I've talked a lot on these videos about the ways in which Baptist is leading amidst this crisis. One of those ways is certainly with testing. We're testing as many people as possible so that positive patients can be identified and quarantined. And some of you have asked me, what are the numbers in my community, or how much spread is occurring in my hometown? Well, I want to show you. Let me emphasize that these are only the numbers for patients that Baptist has tested. In some cases, we're the only providers doing testing in certain communities, but in others, we're just one among many. However, as of last night, we had tested 7,211 people. Now that's up from 6,543 the day before. So we're testing between 500 and 700 patients per day. As you can see on this chart at the bottom, 520 of those 7,211 patients are positive. Now that's a positive rate of 8.68%. Please keep in mind, that doesn't suggest that 8.68% of our population currently has COVID. What that says is that 8.68% of the people with symptoms who are coming to us for testing have COVID. You can also see what the numbers look like in your community. You can see our range. We still have not had a positive case tested at the Women's Hospital. However, in Yazoo City, 24% of the 34 people that we tested were positive. But 34 is a low sample size compared to the 1,516 people that we've tested across the state of Mississippi. Now, look at this graph. This is a different way to look at these same data. On this graph, you'll see the number of tests that were positive of the tests we ran that day. So yesterday's rate was 9.4%, but that's down from a high of 27%. So what we hope this is an indicator that some of the shelter-in-place orders are working. We're still predicting a surge of patients around the middle of April. However, for now, these are our data across our hospitals. We have 42% of our staffed beds that are empty and available for the surge. And of our 255 ICU beds across the system, 100 of those are empty and available for the surge. So our capacity is still very strong. Our PPE supply is adequate, and the number of COVID patients in our hospitals is still relatively low. I'll continue to keep you updated as this changes. To end my video today, I'd like to share something with you, if I can make this work on my computer. I continue to see photos on Facebook and other places of how much our community is turning out to show their support for you and what you're doing. So I'd like to share some of those photos with you, and then at the end show you my personal favorite, which is a video from yesterday of the parking lot at Baptist Attala that was full of cars all there to honk their horns in support of our team at Attala. So I hope you enjoy, and we'll see you again on Friday. Thank you.